What is hypertension? The heart is a muscle that pumps blood through your body. Blood travels in tubes called blood vessels. There are two kinds of blood vessels, arteries and veins. Hypertension, also known as high blood pressure, means that the heart has to work harder to pump enough blood through your body. This can be dangerous. What makes my blood pressure go up or down? Running to catch the bus, going up the stairs, or feeling nervous can make your blood pressure higher. This is normal, but some people have blood pressure that is high most of the time. This can lead to serious medical problems. There are many things that can cause high blood pressure, including having too much salt, being overweight, not exercising, stress, drinking a lot of alcohol, smoking could all cause high blood pressure. It is also hereditary. If a close family member, your mother, father, aunt, or uncle, has high blood pressure, you could have it too. When should I go to the doctor? Hypertension often does not show warning signs or symptoms. Most patients do not know they have it. High blood pressure can cause heart disease, heart attacks, when some of the heart muscle dies because blood cannot get to it, and strokes, when there is a block or break in a blood vessel in the brain, can be caused by hypertension. But it is very easy to measure blood pressure. Make sure your doctor checks your blood pressure often. They will put a cuff on your arm and pump it up. It will feel tight, but will not hurt. Blood pressure. Why are there two numbers? Your heartbeat has two sounds. The first sound is the heart squeezing, contracting, to push blood into the arteries. The second sound is the heart resting, expanding. When your blood pressure is taken, you will be told two numbers. Both numbers are important. Example, 120/80. The first number is systolic, the pressure when your heart is contracting. The second number is diastolic, the pressure when your heart is resting. Normal blood pressure is when the top number is less than 120 and the bottom number is less than 80. High blood pressure is when the top number is higher than 140 or the bottom number is over 90. What if I do have high blood pressure? What can I do? If you have high blood pressure, do not panic. You will need to make some changes in your life and may need medicine, but you can live a normal, happy, and healthy life. By making healthy changes, like exercising and eating the right foods, you can take control of your high blood pressure. What type of medications would my doctor prescribe? Your doctor may give you medicine to lower your blood pressure. It is very important to take all your medicine, even if you start to feel better. Stopping your pills will lead to harm. Make sure you understand which pills to take, how many, and when to take them. Keep taking your medicine even after your blood pressure becomes normal. If the medicines are too expensive, ask your doctor for a less expensive medicine or to recommend a program to help with free or low-cost medications. Why do I need to exercise? How will exercising lower my blood pressure? Exercising is one of the best things you can do to lower your blood pressure. Check with your doctor to find out which exercises are best for you. Aerobic exercise, when you breathe a little faster, is healthy for the heart. Slowly work up to an aerobic session lasting 20 to 30 minutes, 3 to 4 times a week. Go for a walk. Run after your children. Play sports with friends. Dance to your favorite song, or go to gym. Exercise is also a great way to deal with stress. What does my weight have to do with my blood pressure? Exercise also helps you keep a healthy weight. Adults who put on weight often add fat to their entire body, especially their stomach area. This kind of weight can lead to high blood pressure, high cholesterol, diabetes, and heart disease. What changes should I make to my diet? Another important change is eating a healthy diet. A heart-healthy diet is low in fat, cholesterol, and salt. Cholesterol is a fat-like substance made by your body. You need some cholesterol to be healthy, but too much can cause a buildup in your blood vessels. This makes it harder for the heart to pump blood through your body. What are the healthy foods to eat? Eating lots of fruit, vegetables, whole grains, and low-fat dairy products can help protect your heart. Eat at least 5 fruits and vegetables each day. Fiber foods like suji and oatmeal and legumes like peas, beans, and lentils are good choices. Low-fat protein and some fish can also reduce your risk of heart disease. How can dairy help to reduce my blood pressure? Low-fat dairy products help control your blood pressure. They give 3 important things to the body: calcium, potassium, and magnesium. Eat paneer, dahi, raita, non-fat milk, non-fat yogurt, and low-fat cheeses. Some mithai like sandesh, koa, kulfi, barfi, and misti doi are milk products but are high in sugar and fats. Eat those only in small quantities. Which foods will cause my blood pressure to go up? Salt can increase your blood pressure. Food that comes in cans or packages contains a lot of salt. Kole, rajma, achar, and papad are high in salt. This does not mean you have to give up all tasty foods. Try to eat fruit instead of mithai. Use other spices instead of salt. Use dry beans and lentils rather than canned foods. Remember, vegetarians can also get high blood pressure, heart attacks, and strokes if they do not eat healthy foods. What else can I do to improve the health of my heart? Do not smoke or use other tobacco products. Chewing tobacco, cigarettes, pan, and gutka are harmful to your health. Secondhand smoke when you're around someone else who is smoking is also dangerous. Using tobacco is one of the biggest risks for heart disease. What steps can I take to improve the health of my heart? Get regular health checkups by a doctor or nurse. Adults should have their blood pressure checked at least every year. If you know you have high blood pressure, you should check your pressure as often as your doctor advises. You should also have your cholesterol levels checked at least once every 5 years or more often if it is high. For your visit. When you go to a public hospital or clinic, you need to take a few things with you. 1. Proof of identification, like a passport, driver's license, or birth certificate, or anything else with your name and photograph. 2. Proof of income, like a photocopy of your paycheck, your latest tax return, a letter from your boss to help the hospital know how much you can afford to pay, or many hospitals let you sign a letter telling them what your income is. 3. Proof of insurance, like a copy of your insurance card, only if you have it. You will still be seen even if you do not have insurance. A healthy life is up to you. If you have hypertension, eating healthy food and exercising will help you take control of your high blood pressure and live a healthy life. If your doctor gives you medicine, it is very important to take it exactly the way you're told. If you have any questions, ask your doctor, nurse, or pharmacist. The more you know, the more control you have of your hypertension.